The LMA Flexible has been around now for just over 20 years, and in my hospital, my senior colleagues recognised 20 years ago that by using a flexible laryngeal mask airway for ENT procedures, there is a dramatic reduction in the number and of recovery problems during the recovery phase of anaesthesia. So we know that ENT procedures have a disproportionate number of problems in the recovery phase. It's one of the things that's recognised with ENT practice. Because we're manipulating the airway, there is shared airways, there's potentially contamination of the upper airway with blood and mucus and secretions. That all leads to increased problems in recovery. And what my senior colleagues 20 years ago recognised was that if you can utilise a flexible laryngeal mask airway, protect the whole of the laryngeal inlet, not have any blood or mucus secretions or any contamination of that glottic area, then the recovery phase is much smoother. And the studies that they performed 20 years ago that have been repeated across the world, comparing flexible laryngeal mask airways against tracheal tubes for recovery phase, shows quite convincingly that the flexible laryngeal mask airway is superior for ENT practice. Now, of course, that doesn't mean that it's universally practiced, and in my hospital we perform about 6,500 or so, 6,000 ENT procedures a year, and for the last 20 odd years we've been about 80, 85, 90% as the years have gone on. That's the number of cases we do. So tens and tens of thousands of tonsils and ear cases and nose cases we've performed with a flexible laryngeal mask, and we know that it provides a more superior profile.